For this video, we're going to talk to you about what happens in the postnatal period after you've had your baby and give you some advice on the support available and some information on infant feeding.
Following delivery of your babies, the hormone drip called oxytocin, which would have been started, will continue for 4 hours post-birth of the babies. You will remain on labour ward for this time and may even stay for a couple of hours longer, depending on how you're doing. Shortly after the birth of your babies, you will be offered vitamin K. This is to protect them from something called vitamin K deficiency bleeding. Vitamin K is a vitamin which naturally occurs in foods, and we all need vitamin K to help us with blood clotting. In some very rare cases, babies can bleed internally, and this can be without risk factors. So we just recommend that all babies have some form of vitamin K. If you choose for your babies to have vitamin K by injection, this will be a one-off dose. However, if you decide that you don't want your babies to have injections, it can be given orally, and this will be given over a period of time, and you will be sent home with it to follow up on the treatment.
Many new mums worry about what will happen following delivery. For example, how will I cope with 2 babies after a Cesarean section? Here at St Peter's, we aim to continue that support with a team of midwives, maternity assistants, nursery nurses and dedicated infant feeding team, and encourage you to ask any questions or ask for any help you need while you're staying with us. Following a Cesarean section, you'll be immobile for several hours afterwards, and we'll encourage you to mobilise around 8 to 12 hours following delivery, at which point your catheter can be removed. Early mobilisation following a Cesarean section is encouraged to help reduce the risks of developing a DVT. You'll also be given stockings and daily injections of a blood thinning medication called enoxaparin. We recommend that you take analgesia regularly following delivery, and this be offered at regular times on the postnatal ward. Paracetamol and ibuprofen are effective when taken at regular intervals, and you can continue this at home. Further medications such as tramadol or Oromorph may also be given for the initial few days whilst you're in hospital.
If your babies have been transferred to the neonatal unit, we will support you to hand express and show you how to use a breast pump. Pumps can be bought or rented as needed, and we can show you how to use these whilst you're on the ward. The neonatal team will also give you further support and advice on this. The infant feeding team have already produced some videos regarding infant feeding on subjects such as anatomy and the value of breastfeeding, antenatal colostrum harvesting, positioning and attachment, and skin-to-skin contact on the maternity unit. We will also be able to support you with bottle feeding if this is how you have chosen to feed your babies. We recommend that you bring enough formula, sterilised bottles with you for your convenience. Here's a short video from one of our infant feeding support workers, Leanne, to discuss more on this.
When babies are delivered, we would encourage that babies breastfeed as soon as possible. The midwives and maternity assistants and nursery nurses will all be there to support you to do this. If babies have been taken to the neonatal unit, then we will support you with hand expressing. When you come down to the postnatal ward, babies are managed under what we call a bobble hat pathway, and this is to ensure that babies feed effectively and that they're managed properly before you are discharged. The majority of multiples will be on the red bobble hat pathway, which is a pathway to ensure that breastfeeding is established and babies are monitored feeding throughout the duration of the stay in the ward. Under the red bobble hat pathway, so multiples, low birth weight and prematurity, babies will be on the hypoglycemia pathway. This is where we monitor blood sugars within the first 24 hours. Again, that will help us to ensure that collecting your colostrum will help us ensure that baby's blood sugar is maintained. This will be done to all babies on the red bobble hat pathway. This will include a heel prick test to baby's heel and a little prick. Baby will need a little bit of blood. We put it onto a monitor and that will give us the reading of the baby's blood sugar. The majority of multiples will be staying on the ward for anything from 3 to 5 days post-delivery. This is to ensure that babies are feeding effectively before discharge. We will be able to help you with positioning and attachment on the ward and help you with throughout your breastfeeding journey. There are also videos on our trust website which you can have a look at before you come into hospital to have your baby. We have various clinics in the community for postnatal support for feeding, and they again will be on our trust website, and when you are discharged you will be given an information leaflet of who to contact and how to get access to feeding support. At the moment with COVID, we have virtual clinics, so again you can get in contact with us and we can give you feeding support via FaceTime or Zoom, and we also have an email number email address for you to contact if you need any sort of further support.
Postnatal care for mums will be given, where possible, by a midwife known to you throughout your pregnancy, for example, myself and Abby. It's important to ensure your emotional and mental well-being as much as your physical health as well, and we'll be monitoring this throughout the postnatal period. We encourage you to discuss any concerns with us about how you're feeling so we can support you the best we can. Baby blues are a normal feature of this immediate postnatal period due to hormone changes, but it's important to recognise that if these feelings or behaviours become more severe or prolonged, that you gain help as needed. Partners and relatives will be really useful in helping you to identify these differences. Postnatal visits and phone calls will continue at home, with long-term support being given by health visitors and GPs. As in pregnancy, if you have any concerns regarding your health or well-being during this period, you can call the Pregnancy Advice Line for up to 28 days post-delivery.
We hope that you found these videos useful. To follow up on this, we will be offering you virtual meetings on Zoom, which we will be setting up soon. We'll get in contact with you, and this will allow you to have some questions for myself and Claire, but also an opportunity to meet other twin or triplet mums.
This final image shows some important and useful phone numbers and email websites that you can use to contact during your pregnancy if you have any questions. The Pregnancy Advice Line can be contacted on 0300 123 5473. This is an important phone number for any urgent inquiries if you're concerned about bleeding, reduced movements or feeling unwell. This phone number is available 24 hours a day, 7 days a week. For non-urgent inquiries, there's an email address as here below. This can be useful for rearranging clinic appointments or anything like that. Please be aware that this email is not checked daily. Further information can also be gained from the Twins Trust and the National Childbirth Trust. Links can be seen here.